Hey, Gestalt Education Nation. New sponsor alert. Today, we're excited to announce Dynamic Disc Designs and Jerome Fryer. We have an awesome discount code for you. Just use the code Gestalt to get a little bit of money off on the Dynamic Disc Designs. They're the most realistic anatomical discs that we've ever seen. If you caught our episode with Dr. Stuart McGill, you saw an entire shelf full of them. Everything from cavitation instruction to disc dysfunction to SI joint dysfunction, all sorts of amazing
joint
stuff.
movement,
Yes,
vertebral movement.
Absolutely. So go to Dynamic Disc Designs, use the code Gestalt. As always, you can use the code Gestalt on Core 360 belt to get a little discount on the belts there. We love to use that for biofeedback for teaching respiration, intra-abdominal pressure, and how the abdominal wall should be working during function. And then the last one, use the code Gestalt Education 10. Those will all be in the description in the podcast. Gestalt Education 10 at humanlocomotion.com to get off some money off of all of his awesome gadgets and tools and rehab materials. What's your favorite, Brett?
He's got a trunk full, but I think, integrating the Toe Pro in, I think, has been a game changer for us here at the office. So I think that would be my pick.
Beautiful. All right, guys, don't forget, use the code Gestalt, Gestalt Education 10. Visit the show notes and you'll be hooked up. Thanks. Enjoy the episode. All right, everyone. Welcome to another episode of the Gestalt Education Show. We're back in Troy, Missouri. Today, we're sitting around with Brett, with literally your best friend from chiropractic school. So, yes. The one and only Todd Nieder from Harrisonburg, Virginia.
You got it.
Dang, I was so close. So, Todd, you've obviously been out just as long as Brett. You also are a consultant at JMU, James Madison University, as well as an adjunct professor. So I'm sure we'll get into that. But how I wanted to start this for both of you guys. Let's start with Nieder.
Yeah.
Give me your best Brett Winchester chiropractic school story. Give us the lowdown on who this guy was in chiropractic school.
All right. So there are so many stories. I mean, I don't even know where to start. So we both came in the same time. I think we had tried zero together, and that would have been the fall of 99. So we had to take some classes there. So we just met a couple guys in our class, and like Brett and I kind of immediately gravitated towards each other and just started hanging out. And day one, we started having a good time. I think we went out that night and then was like solidified the entire relationship for like 25 years later. Anyways, so going through school, like Brett, as he is today, he can be a couple minutes late. He still has his stuff together. But most of the classes, like class time, like actual class time, we were actually trying to wake Brett up from class. So like
I slept through most of but to my own credit, I worked 3 jobs through chiropractic school. But I mean,
who's telling the damn story? Yet, Brett?
Yeah.
But so most of the class period, we're trying to just hang through there. It's long days and everything, we're going well. And I'd look over and Brett's back there, like full neck extension, like his head's literally off the chair. And we'd have to like bump him like 3 chairs down to wake him back up. So my story for that is always that I got Brett through grad school. And he got me through practice school. So he's still teaching me shit today. Like even today, like I've seen Brett probably as many times as you have at a seminar. So I would say probably I've seen Brett speak, 50 times, close to 50 times, maybe more. And like, there's still some nuggets that I will peel out this weekend. And it's just awesome. And so like, that's my claim to fame is I got Brett Winchester through chiro school and he's getting me through practice school.
That's good.
It's a win-win situation.
He's still in debt to you, obviously. So, all right. What about you, Wendy? What's your best?
I mean, looking back at Todd was kind of that nerd in school. So like he had like 5 highlighters out and like he literally, we'd give him such a hard time because he'd write down everything the teacher would say. So like I would give him a hard time because, I'm sitting next to him and he's taking notes and he'd be writing down stuff he already knew. So I'd be like, Todd, why'd you just write that down? We already know that. Like, there's no need to just write it. And so he'd have his notes like color coded and just, we had different approaches through chiro school probably, but here we are.
Yeah.
So, I would say that's probably my best Todd Nieder story. We worked at Houlihan's together, so we waited tables together. So we had all kinds of craziness as far as that goes. So I think, as everyone knows, I think it's really important in chiro school or PT school that the group that you go through with basically, I think, determines in shapes like who you become, because you push each other, you're competitive with each other in a good way. We were both MPI reps, so we had that in common. So I think, the group that you choose to hang out with in school and in life in general, really, that's basically an amalgam of who you become, kind of, so.
How's that quote go? You're the epitome of the 10 closest people to you, or something along those lines.
Yeah. And I mean, I think, chiro school and PT school is the same way. It's basically about memorization. Well, one thing I was blessed with was a good memory. That doesn't mean it doesn't mean you can critically think or anything like that. So, I mean, if you can memorize stuff, then you will do fine in chiropractic school. So, but I think, the clubs, all the time away from the school is where like great, clinicians are basically born, I think.
Sure.
And I think our group did a really good job. And at Cleveland, obviously we had Corey Campbell. At Northwestern, we had Sarah. We had Tom Lotus at National. We were all like kind of the same age, and we were all just kind of pushing each other. And, that was kind of even like a competition within the schools, I think. And I think that's what really makes for good clinicians.
Yeah. And I think it's still true today. Like, like Lotus and Campbell and you and all of our other mentors that are actually our buddies, they're actually mentors. Like that doesn't really happen in life, right? Like I got buddies and they're doing great stuff, and I'm trying to do good stuff too. But there's rarely the opportunity where you have one of your best friends is also a mentor at the same time. You push each other, and then it's constantly ever getting, better and better and better. And that's what's the greatest thing about what we do. There's not a lot of professions that people just keep getting better at.
Right.
But our limit is there's no ceiling to our limit. We can continue to get better. It's just like golf. You're never going to master the game. Right. And that's what's cool about what we do every day. And that's when I feel like that's where passion comes back too, where guys lose that sense of wanting to get better. And so they lose passion. Then it's it's done deal. Yeah.
I think too, in practice, you're good friends. We always say you're superficial friends. You ask you how you're doing. And you're like, oh, I'm doing great. I'm doing fine.
Yeah.
And then you're really good friends. You call them up at the end of the day and you're like, oh my God, you're not going to believe it.
The truth comes out.
How we have it set up in here with our doctor's office. We come in from the trenches and we all meet back here after every patient. We're oh my God, you're not going to believe what just happened. Yeah. And I think that's what gets you through those long days. If you don't have that good support structure around you, it makes it harder. So
when I think you said a certain thing in the trenches, that's a topic, and that's what this podcast is all about. And so to switch gears a little bit, Todd, you are obviously a rehab consultant with JMU, which is a big time college. I think a lot of people have aspirations for doing similar things, for working in these Division I locker rooms and in these training rooms. And as a chiropractor, can you talk us through how that all kind of evolved and what the current status is of that? And those things? So
back in 2006, where I'm at James Madison University, there was a set of docs were there, didn't work out for whatever reason. And then the sports medicine director was kind of talking to here and there. And the opportunity came back open. And I just called him up, said, hey, I'd love to meet. Here's what I do in practice. Here's what I don't do in practice. And here's how I can help your athletes. Would love to just talk further about you and, about it with you. And he's like, yeah, let's meet up, let's talk. And so out of that conversation, I think it opened the door. Now, you still have to kind of prove your, the proof's in the pudding, right? So it's not oh yeah, just, treat whoever, you'll fine. So they sent me a 4-time All-American who had hamstring pain, right? And the history goes, he had it for 3 or 4 months, wasn't getting better. They're doing everything they can to get this better. And the head athletic trainer said, hey, would you look at this guy for me? He's got to play this weekend. We have to have him in this playoff game. Sure. So, long story long, we all know that what the answer was. It wasn't a hamstring problem. So, we treated it, a couple visits, did fantastic. And he told a couple buddies, and then he told the staff, and it was it opened the door. So then after that case, we started seeing some more football players, and then we saw a volleyball player, and then it was a softball player, so it just kept, snowballing. And then, which I'll get into later, is once you have that open door, we told the staff, say, we'd love to come in and do an in-service with your staff, And it wasn't so much about telling them like what we know. It's more about like, here's what we can offer your team. And that's the one thing I think a lot of chiros that are trying to work with a team at any aspect, pro, high school, collegiate, you have to come in with zero ego because they will sniff that in a heartbeat, right? And so my attitude when we first started was more like, I'm just part of this team. I can do as much or as little as you want, but here's what we do, You take it and I'm going to help your players. So it's always, I'm going to help your athletes. Never, I'm going to see him and take over because they will sniff that out pretty quick. Yeah. So now fast forward, well, I guess, 16, 17 years now, that has evolved and changed because one of the things that happens in the world of sports medicine, the collegiate level, is every couple of years there's turnover, right? So you have to like reapproach and get these relationships back up. And so we're constantly doing that. There's constantly staff changing. A lot of times these big D1 schools that like if the football coach leaves, and brings the head trainer with him, then the athletic trainer goes, with that coach and a new one comes in. So they may have a systematic approach already that's worked for them for years. Do you fit in that equation or not? So you have to kind of, work your way into that as well. And it's all about relationships and communication. So that's kind of where it's at this point. And then going further from the in-service side of things is James Madison was one of many schools in the country now that they have to offer a master's level in athletic training. Mm-hmm. And so the low-hanging fruit for us as chiropractors as being spinal educators is athletic trainers get very little spinal education. If they do, it is like standard stuff, nothing to where we're doing every day, where we're trying to get them into a classification, we're trying to get them into a rehab approach, and then furthering out that progression. So a year or so ago, James Madison got that set up, got accredited, and so they asked me if I wanted to teach that course, with another professor, and that's an eye-opening experience too. So it was fun. We're in our second year now. Our class has doubled, and next year it's going to double again. Nice. So we're looking forward to that, and but that's constantly tweaking as well. Mm-hmm. So it's kind of one of those things where the relationship just continues to get better and better. And now as being an adjunct, it kind of holds a little more weight. So I mean, if you can teach at some level, I think there's a little more respect there, hopefully. But it's always fun to go. I love teaching, so yeah, it's easy for me. Yeah.
It's a fun group. We teach a class at Maryville, which would be about the same, that 300, 400 level class, and so it is fun to have to walk in there and I don't want to say dumb down, but just lower the verbiage you use and stuff like that, and it really makes you, I think through what you're doing every day because. Yeah. I mean, we know anatomy well and biomechanics well, but then to explain it to someone isn't something you do all day. Oh, yeah. Obviously, you do on the teaching circuit, but maybe not to that extent. So I think it's
cool. I mean, I like the challenge of that. That way, because you're like you said. I mean, if you're forced to educate somebody who doesn't have the background, like everyone in the room today at a DNS seminar, they all come from a similar background. So this is a little bit different, and it really forces you. As an educator to really be good at making the people that you're speaking to at that level versus I think a lot of educators, their goal is to sound smart and things like that, right. Which doesn't make them a good educator actually.
Yeah, actually I'm lucky that Connie Peterson is the other professor at James Madison. She's been there for a long time. And so she's always pulling me back. She's like, Todd, I'll go into a subject. She'll Todd, she's pulling me back. She's don't even go there because you're going to lose them in 5 seconds, Right. So that really helps co-teaching a class like that. But yeah, I've learned just know your audience. What are you trying to explain there, and how in their mindset, in their shoes, are they going to be able to absorb this information? Mm-hmm. So we're constantly revamping our class because we learned from that first spring semester we taught we were just having their face up to the fire hydrant. There was no way we were going to accomplish what we wanted to do. And so it's constantly an upgrade every semester. I think next year it's going to be even better than it was last year. So
I think the question a lot of people are going to want to know is, so I mean, if you were giving advice, obviously you have your miracle story where you lucked your way into treating an athlete, and that led to that. What advice would you give for a young chiropractor who wants to work for a college? What do you think the proper steps would be to make that happen?
I think it's like anything else. I think the relationship side of it has to happen first. If there is a way to get to know somebody on like a friend level, like one of the staff members or a wife of a staff member, like there has to be some sort of way to kind of cut your teeth into it,
Wife of the staff member?
Yes.
Let's just, all right, I'm just
You like a neighbor.
I'm just joking.
Let's go. Come on. But, I think for me, like so I've known several athletic trainers in my area, and they were at the high school level, then eventually went to collegiate level, and I've made a great relationship with them, and they remembered me. I remember them. I always do extra for them as much as I can. If they need an athlete to get in, I'll change my schedule around. And so I think that helped as well, because guess what? It's just like medical doctors, right? Yeah. Like you get medical referrals from a doc you've never met before. Mm-hmm. Well, it's also a small knit community of athletic trainers. Like they will talk. Like if you're good, if you treat people right, do the right stuff, like they're going to talk. And so I think that's really helped me. So relationship number one, to answer your question. And then I think at some point you have to offer some sort of niche that the school doesn't currently offer. So us as chiropractors, manipulation might be the number one tool, right? But then we might do DNS and MDT and like soft tissue. And so like I had the talk in Kansas City a month ago, like, but is that what the university wants? Mm-hmm. Do they want just somebody to kind of tweak that one little treatment tool and then they can handle the rest? Or do they want you to do everything you can to get this person better, communicate with them, and then do it? With the staff I work with right now, I see a little bit of both. Some just want that, and some want the whole gamut. And then we educate them, and then we say, okay, follow up with them on their breathing, maybe put them in this position and start to work that a little bit, look for these things. And then it comes back, because it's kind of fun, right? Like you're treating the patient, but you're teaching the athletic trainer your mindset and your approach in the same time. So they're learning something. So guess what? We start seeing the staff members come with the athletes to the office. And it is like a treatment and a teaching session all in the same 15 minutes. Yeah. Yeah. And that's like that teaching term I came out with, like last month. Like if you can do both really well, it cements that relationship, and not, it sounds easy, but you kind of have to be talking and treat like you did today. Like you were treating and talking at the same time. And that's what you have to do. But like, it's not talked enough. It's not about like how good you are, how many letters you have behind your name. It's really about that relationship communication side.
Do you have to worry about, can you be too good in that environment? Do you ever worry about like, if you educate everybody on what you're doing, that potentially then all of a sudden you may not have a place at the table? Yeah.
I've seen that a little bit in the past. But at the same time, they come back and they consult with you on this. Like, we tried these press ups and they didn't change them. Okay. Well, how did they do the press ups, And how it is. We see sometimes they just don't get it in range, and they're like, oh, okay. Yeah, I see that now. So like, I think that can go one or two ways. I think, obviously we always talk about, do we give our referral sources and the people that refer to us the playbook or not? Mm-hmm. I think at the end of the day, most are going to come back to you and see that you're the expert in it. So now we're 20 years in practice. So I kind of feel like we're established enough that like we can do that. Like a year one chiro, you're going to learn stuff and, you have to make that relationship as best you can. But I think it's one of those things where it can go either way. You just have to be careful not to project an ego with that.
I think too, you're always better off going on the side of educating people around you. Because really, and Taylor and I talk about this. You have two different approaches at some point in your career, especially if you're really onto something. You can close all the doors and not let in. A lot of people do this, especially the people that work with professional athletes. They don't want anybody to see what you're doing.
Sure.
Or the other approach is, we're going to go all in on education. We're going to educate everyone around us. And so there's almost like a fork in the road of like two different approaches. So it depends on, what your aspirations are for your career and how you're going to leave the profession. Maybe, I don't know.
Well, I think too, I would say we would agree with your sentiment on coming at it with no ego and just constant communication, because even at the high school here in Troy, there was barriers when I first started being there more often.
For sure.
A little bit of like, it's an ego check on everybody, because I tell the stories. I kind of sat back and watched a lot of stuff that I didn't like how it happened, didn't like how it was being done, but it wasn't the right time because the relationship wasn't right. Like we weren't close enough for me to intervene. And I feel like if I would have intervened too early in those steps, then that would have destroyed the relationship. And so you kind of almost live with some shittiness, if that's what you want to say, early on in an attempt to then make bigger changes long term. I think it's just with any relationship. You got to pick your battles, and at some point you're going to have that fork in the road where you put your foot down and say, no, we need to start doing it this way. But you got to build the repetition, you got to build the rapport with the athletes, with the coaches, with the trainers, and I think you'd probably agree with
for sure. And I always try to like end a conversation with like a staff member like that, like whether it's high school, collegiate, whatever, is that like, I try to tell them like, here's what you did really well with this athlete. Mm-hmm. And I think that helped us get to point, A to B. Here's what I learned from the case, and so again, that's like the ego checks way out the door. So I don't come across saying, well, you didn't do this right, and we did this right, even though we would see in our eyes like, oh, well, maybe they didn't do this quite right, or they took them to another direction that didn't help them. And I think that's it. It's just, if they sense that, they feel that, then the relationship builds. And then now there's more open doors for you to inject what our approach is, the integration. Yeah,
that's exactly right. That's exactly right. It's such a hard environment too, because especially like if you're in a big time, training room, like a Division I or Major League Baseball or whatever that is, like everybody, it's kind of life or death in certain situations, like everybody's vying for their own job. You got an outsider coming in that, could be misconstrued that you're doing the wrong thing, or, things like that. So how do you, I guess we're still just like, how do you approach those situations, and like, how do you make changes maybe on a microscopic scale on patient to patient visits?
So with that, I think it's about like, so a couple years ago, we would be treating, prior to a game, let's say a football game. And so the same thing, you kind of have to know what you're dealing with in front of you, at the same time, not projecting too much of what the head staff member didn't want either. So to try to be aware of that while trying to take the needs of the athlete in front of you and dealing with like both sides can be tricky. Mm-hmm. But I just think open communication is the most important thing. Like I would just always go, hey, I saw this on him. This is something that we can work with this week. Mm-hmm. I dealt with a little bit here. Did he tell you about this situation? Because that's another thing that happens is like athletes will tell us something totally different than their athletic trainer.
Right.
For a lot of reasons, and that's a whole other podcast probably, but like, so you kind of have to, be aware of that as well. And I was always open. Like sometimes we would have athletes come in that, it didn't go through the school's insurance program and all that stuff too. They just want to come in because they heard something or whatever, so we're like, we're always going to talk to staff. So just let you know if you're okay with that, all that stuff. Like, we're let to know. And so it's funny because the staff member come back, they never told me about this. I was like, well, this is kind of what it is. So, so then the communication's there, you bridge the gap, so they can always trust us, like we're not going to just try to sneak something past them. Right.
Same with you. What lessons do you kind of have on that question, just from my own personal gain on you being in a major league training room?
Yeah. I mean, I think that, it's tough because like you have a liaison with the player, but then you're also, with the team. Mm-hmm. So, I mean, a lot of times you get put in a difficult spot, quite honestly. And the people on the outside are called kind of bandits, where they come in at night and they treat all your athletes and then they walk out. So I think it just depends, like, whether you're on the inside or the outside. The people on the inside don't always love the people on the outside, and vice versa, And then I think if you are on the inside, a lot of times you get taken for granted by the athletes, even because they just think like, well, you're a company person, you work for the team, So I think that can sometimes hurt you maybe a little bit. But yeah, those are some of the inner. I mean, it is tough in those environments. Whether it's a high school, college, or I mean, the one thing I've learned moving, as I've aged, is it's the same problems with a professional team as it is with running a business, with running a college, with, you know, like you have the same kind of stuff that always kind of shows itself, shows its head. But
sure.
yeah, I mean, I would say.
What about, do you guys have any maybe stories or situations, or how do you approach when it does come time for you to put your foot down? Or like, you know, at what point, you know what I mean? Like how
Well, I think the
how's
one
that all
thing
coming?
you never want to do is you never want to compromise yourself.
Yeah.
And you never and I've had this happen for me at times with different situations where you're almost becoming a watered down version of yourself. And the reason that's not great is then if something doesn't go well, then you really weren't able to do what you would have done, but your reputation's kind of on the line. Or like if you're just known for being able to do like a certain modality that a team wants, for example. So like maybe, you know, Todd knows how to dry needles. So when you get there, you dry needle, but then you're not the one that is like analyzing the whole case to see if that actually makes sense for like at the time or that case, and or the location that you're putting the needles in. So I mean, I think those are all like really difficult things to kind of reconcile in your brain as you try to like figure out and navigate those waters, because there's so many different variables. And I mean, I think too, one thing I've learned with in all sports, mostly professional, but also collegiate, is that there's a problem with overtreatment. So, you know, the athlete will come in, they've had a massage that day, they've already trained, they've been dry needled, they've been manipulated, they're doing a DNS session, and just because they're there, they think they may be doing something. So what ends up happening is you have, and I always kind of joke that the athletes kind of come in, it's almost like a la carte, like they're just telling everybody what they want. And I mean, like we've learned with like certain professional athletes, without naming names, like usually the professional athlete themselves, as much as they think they control their situation well medically, they actually do not. And so, you know, like I think it's really important, if I was giving advice to a young professional athlete, build your team and like really like trust them, because you're too close to the situation to make good medical decisions yourself.
For sure. Yeah. I
And that's a huge mistake. And I mean, you'll see like a lot of people are like getting advice on the side, and then the people that are on the inside, they don't know that all this extra stuff is going on because they're not being told. Well, imagine like your athlete coming in and they've had a whole 1 hour session with somebody before they get there, and you don't know that occurred. I mean, come on, like, you know, so, and I don't have an answer for it, but I mean, I'm just saying, but except for the fact that if the athletes have confidence in the system, then they will, I think, buy into, you know, what you're selling. And then if you can't do that, then they're of course looking for advice on the outside. Yeah.
And we find that too, like top down. So like if the team physician saw him and said, you have a rib, you know, fixation. Okay. We're going to send you this guy. He fixes this all the time. Like, you know how it is. It's like they almost are better the day they walk into your office because they were told they're going to get better. Right. Mm-hmm. Or if the team ortho says like, yeah, you have a little bit of a, you know, labral lesion here, but you're non-surgical. We need to rehab this. And here's the people you're going to see. You see this guy, and then you see staff. And so I think it's a team approach. If everyone's on the same page, and, you know, it makes our job somewhat easier, but also somewhat harder depending on how you take that case.
Well, here in our office, we call this referral with a blessing. Yeah. Which means like if I'm going to refer, maybe I'm going to refer to Taylor for somebody, or like a nutritionist here, or whatever it might be. Like if we say, oh, this person is like so good at what they're doing, you are going to love them. This is what they do, and this is what they do well, versus like, I just need you to see this person. Yeah. And we call that here a referral with a blessing, which means like they're already getting better because you've already like really set them up to do well with that, with that particular person, you know? And I think that's actually really, really important.
Yep. I agree. Beautiful. And then what about your office setup? Tell us a little bit about how you integrate in the office and what that looks like.
We have kind of a very similar setup you guys have, just on a little smaller scale. So I have Associate Dr. David Glazer, who's been with me for just over 10 years. We have a registered dietitian who, Holly Van Poots was her name. She's actually more like a functional medicine, you know, type approach. We have Nell Fox. She's a trainer who is more on a running performance side of things, but she's, you know, going to be slowly slowly learned some DNS stuff and trying to incorporate that in. And we have a great massage therapist, Kathy, with us for 3-4 years now. So I didn't steal yours. It's a different one. But same thing. Like, you talk about referral with a blessing. So we obviously do that really well in our office. We try to do that also really well outside of our office. So like if we got to send somebody for injection, like we have your guy. If we need just to get another set of viewpoint on this, an ortho or a pediatric ortho, we know where to send you, and so that really helps, not only just a case, but a community to build trust with you. And I think over, 20 years we've been in practice, I think we're at the stage now where we have that trust in the community, people, we hear all the time that we're just going to treat people right. We're not going to overtreat them. Hopefully not undertreat them. So very similar setup with what you guys have, on a smaller scale. So yeah, very cool. And it's great. And it's fun to me. Like I always wanted a team, like, cause we played, 3 sports in high school and college and all stuff. And so like, I always wanted like this team approach where like I have everyone's benefiting, everyone's winning. I think the win-win situation is sometimes pushed aside nowadays. And so like if you have that, everybody wins, like everyone's happy and busy and it's fun that way.
Beautiful.
So, yeah.
And then what techniques are you utilizing? What are you integrating together? I know it's probably similar to ours, but maybe just walk us through what that looks like. Yeah,
so we start with the MDT assessment, and then we will joint play, check tension, trigger points, stuff like you talked about today. And then we educate our patients on like why we're doing what we're doing right now, this visit. So we might start breathing with them day one. We might not. We might just try to find directional preference, try to classify them. And then we try to educate them on like why we're doing this certain thing down the road, and we will use deep tissue laser, obviously different soft tissue techniques, joint manipulation. And then DNS is a huge part of, I think, how we see things long term. So I think DNS explains why you have the issues you find in MDT. And then we talk to the patient about like, here's what we're going to use for you long term. Not that DNS can't make an initial immediate change day one. It can. But I think what we try to find is we try to get them on a program where this is what's going to happen. Here's your routine for a long time. Right. Because we always get out the answer. Do I have to do these retraction extensions the rest of my life? Right. No, but you go back to sitting at a desk 8 hours a day. So we got to fine tune. We have to balance that out a little bit. Very cool. So yeah, and the associate Dr. Glaziers and I mean, we're always kind of going back and forth on like, what about this? Have you looked into this? Like, what do you think about this technique? Did you try this? And like, I tried this movement with this position and that helped. And so that always kind of, is good when you have a team. It's like, we're going to try things and, see if it works for this person or fine tune like what we've been doing, like this weekend. Like I'm already going to fine tune a little bit of my, positions. The MPI seminar a month ago, like, who else? I forget who else said this, but like, there'll be a better manipulator that week. And that was the truest story ever. Because like, I was so much better like week after MPI, so like, I think that's a big testament to MPI, to what you guys are doing every day. Like 20 years out, like there's still that passion to kind of get better. Yeah. And it actually does happen. If you just put the work in a little bit, so. Okay. And then what about, to just kind of finish things off here, like what advice do you wish someone would have given you maybe in that last year of chiro school, let's say like that 5-year window, kind of last bit of chiro school, first couple of years in practice, like what advice do you wish you would have known? That, like everything's going to happen for a reason, like if you think you're on top of the world, just wait a minute, tomorrow you'll get beat up. Yeah. When you're beat up and you're like, why am I doing this? Like, I can't get this right or whatever. Just wait a minute. It'll get better the next day. Yeah. Like it all gets better. And I think there's a reason why we're sitting here today. There's a reason why we integrate with people that have influenced our lives over the years. So don't fear the unknown and just keep going. Yeah. that's it, man. That's what's helped me in 20 years, and following this dude around.
I think, for practice too, it's so humbling, and it's such a weird feeling because there's some things in life where you get to the top of it and there's nowhere to go. And what we do, there's just always other stuff. Exactly. You can never be too good at what, we do. And like you said, you'll walk into a patient on Monday that is just going to drive you nuts, Mm-hmm. So, I think that's what is so alluring about this profession is if you're up for the battle, yep. You really don't burn out because you right. almost as you move along, when you're young, when yep. I was 5 years out, I thought I knew everything.
Right.
I'm 20 years out and I'm questioning everything. It's so funny how it all works. And so I think that's good advice for sure.
Beautiful. Thanks for sitting down with us, bro. Thanks for being here. Thanks for being a good friend. We really didn't talk about golf, but that'll be our next episode.
How did we not talk about golf?
We didn't talk about golf.
I mentioned it a little quickly,
that would be a whole nother
life
episode.
Mimics golf,
No. Well, is that the number one way that you blow off steam or you
Sure. Yeah. That's my drug. So thank God it's a great drug because
yeah, you could be doing what Brett does. My God.
We won't mention that, but if I hit balls for half an hour, I'm a better father that day. Yeah. I'm not joking you. If I just can hit some balls for half an hour. Right.
Spoken like a true addict.
Yeah. I'm a better father.
I can handle it. I can quit whenever I want.
Yeah.
Right. But yeah, that's it, man. It's fun, man. And I've been blessed. I got the luckiest, girl. I got lucky to find an awesome girl in Kim. You would say the same thing about Sherry. How many people say marry the right person, mm-hmm. and step one,
Yeah.
So I got lucky there, and then, great kids and great community. And then, it's all good. So
beautiful,
but it was fun. Appreciate it.
Keep integrating, guys. Keep pushing forward. And if people want to reach out to you, if they have more questions about you, is there a best way to find you?
Yeah, I'm not a huge social media guy, but we do have an account on Instagram. It's Nieder Chiro Rehab, Facebook and all that. Our website's functionalchiro.com. So perfect. Reach out.
Awesome.
Let's do it.
And if you're in Harrisonburg, Virginia, look him up. Go shadow him and learn some good stuff. All right.
Appreciate
Thanks a lot, guys. Anything else, Brett?
Nope.
Let's go play some cornhole.
Let's go.
Later, guys. Thanks for tuning in and good luck with patience. I hope you enjoyed this episode of the Gestalt Education Show. If you liked it, share it, subscribe to it, send it to your friends, send it to someone that needs to hear this message. We really want everyone to be able to tune in and get the best clinical advice that they can, which we're hoping that we're giving to you with these special guests. So if you have any questions, please feel free to reach out to us, or if you have any suggestions on upcoming conversations, let us know. For a list of our upcoming courses, we're adding them all the dang time. So go to gestaltedu.com, click on courses, and they'll all be right there for you. All right, have a good day.